Good afternoon, Mr. Big Yellow Cup. My name is Butterworth, and if you see here on my badge, it is MA. I'm a medical assistant, Butterworth, and I am going to help you with some of your testing today. First off, we're going to do our distance visual acuity test. I've already washed my hands and prepared the area. Put on gloves. We know that we went over and we know that you are not hearing impaired. If you were, I would have to speak softly and a low tone and make sure that you can hear me. But because you are not hearing impaired, I can talk and speak to you like normal. First, we're going to do our distance visual acuity. We have our chart up on the board already. And then we are just going to get in position. We have this little mark on the ground, and that puts you at 20 feet. So we're going to have you step up to the line. And then you're not wearing glasses. Are you wearing contacts? No contacts. Okay, perfect. So we're not going to try and squint. We're not trying to lean over. We're just going to stand up. We're going to read them. And we're going to start with the left eye. So I want you to leave the right eye open. And we're just going to cover your right eye. So that you can't see the chart with your right eye, but just your left. Don't try and squint. Just read the chart, starting the top line. E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, P, E, C, Z, T. All right, very good. Now we're going to do the same. We're going to cover your left eye. Keep it open. Don't close it. And then start at the top again. Let your eyes adjust and work your way down the chart. E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, P, P, Z, D. All right. Looks like you are 20/20 in both eyes. Standing at the line, seeing what a normal person can see at 20 feet, you can see standing at 20 feet. Good job. Now our next test is we're going to see if you're colorblind. I have this little book here to see if you're colorblind or not. Then I'm just going to flip through the pages, and you're going to try and read them and see if you can see the numbers on the pages. It's okay if you can't see them or not. Just let me know what number or letter or symbol you see, or if you see them at all. And as you give me your responses, I will mark them down, and then we will check them against the key when we are all done. Go ahead and start. All right, looks like you are not colorblind. Next, we are going to put some eye medications in your eyes. I've already washed my hands and I put gloves on again. Looking at your medical chart, I checked my medication 3 times. I have sterile gauze and tissues ready. So to put the drops in the eyeball, what we're going to do is we're going to have you slightly put your head back, tilt it back just so, and then I'm going to take a little bit of gauze and pull down on your eyelid, on your bottom eyelid. So what we're going to do is we're going to take the 2 drops that we're ordered to drop, and we're going to drop them right at the base of the eyelid underneath the eye, so we're not dropping directly into the eyeball. And what we're going to do is I'm going to have you look up. I'm going to drop into the bottom, 1, 2, and then I'm going to have you close your eye and move your eyeball around, and then go ahead and blink if you like, but don't try and squeeze it. Don't try and push it out. Move your eyeball around as much as you can. Look in all directions. If we leak or have little tears, I'm going to go ahead and wipe that with the tissue. And since we were ordered 2 drops, I'm only putting 2 drops in. So if anything leaked out, I'm not putting extra in. And then we're going to lean back again when you're ready. Pull that eyelid down. And then we're going to go 1 and 2 again. And then go ahead and let you close that eye. Move it around just like you did last time. Go ahead and open it and blink if you like a little bit. If we get anything out, dab it with the tissue. For our next procedure, we are irrigating the eye. Start by washing our hands, all clean again. Assemble the equipment, supplies, and the medication that we were ordered. We checked the order, checked it 3 times to make sure it's the proper medication. I greeted our patient and we identified the patient. And then we're explaining the procedure. Making sure that you're not allergic to any medication. Every time we give you new medication, before we do, we're going to make sure that you don't have any allergies or confirm the ones that you do have, even if we've seen you before. Now we're going to position the patient comfortably, and we're going to tilt the head and the affected eye lower, and then drape the patient with a protective cover. And then we are going to take this left eye, we're going to position it a little bit lower, and then we're going to have them close the eye. We're going to wipe it, get all the debris or anything out of the eye or off the lashes. And then we're going to gently irrigate the inner to outer canthus, holding the syringe about 1 inch above the eye, and spraying water or saline or the solution that we were ordered to spray, and we had checked 3 times, from the inner to the outer. We're going to have a little boat or something below to catch anything, any debris and any of what we're spraying, any of the solution. And then the reason we wiped first is so that any debris that was in the eyelashes don't get into the eye itself. We use tissues to wipe any excess solution from the patient's face. And then we're going to properly dispose of the equipment and sanitize as recommended, and remove our gloves and wash our hands. Next, Mr. Cup, we are going to irrigate your ear. Your ear. We washed our hands and we got all our supplies and equipment together, and we talked to our patient about what was going to happen. And then we went ahead and gloved up and we were about ready to do everything. And then for a child, we would grab a hold of the ear and pull back and down. For an adult, we'll go back and up to get that ear canal nice and straight so we can see into it. We're going to use an otoscope to locate the foreign matter or the earwax that we're trying to flush out. Then we're going to put a drainage basin underneath so that anything that does come out will go into the drainage basin, not everywhere. And then we're going to position it with our non-dominant hand, using our dominant hand to spray the solution in. Then we're going to spray the solution at a gentle, steady stream until we are able to remove the lodged foreign object or the earwax. And we're just going to keep spraying until we fill the irrigating syringe and irrigate again if we have to. Then we just continue irrigating for the prescribed period or until the desired result, until the cerumen or earwax or the foreign body is obtained. Then we're going to dry with gauze, and then we're going to have the patient lay down or sit so that the ear can drain properly afterwards. Next, we're going to perform an audiometric hearing test. Now we've washed our hands, we've greeted the patient, we've made sure that we've explained the whole situation to them, and then we have gloved up again. And then using an otoscope or an audioscope with a light source, we're visually inspecting the ear canal and the tympanic membrane before the examination. We're just going to look in there and see what we can see. Now remember, a child, back and down, an adult, back and up, to straighten that so we can see what's in there. Make sure we're going to choose the correct size tip of the end of the audiometer. Attach a speculum to fit the patient's external auditory meatus, making sure the ear canal is oculoid with the speculum in place. With the speculum in the ear canal, retract and pull back and up for an adult, back and down for a child. Now we're going to screen the ear, and we're going to turn the instrument on and select the screening practice if we got to practice one time, and then we'll just begin it, and they will raise their hand if they hear it. If the patient fails to respond to any frequency whatsoever, we'll have to do it again. And then once we're done, we will rotate the patient or go around the other side, and we will do the other ear. If we have screened them both times, both ears twice, each ear twice, and they failed absolutely on both ears, both sides, or just one side, either one, you have to notify the physician immediately. Now, Mr. Cup, I know we've been through a lot today, but we have one more thing to do. As your MA, I try and do as much as I can before the doctor gets here or after the doctor so he can see other patients. So I am going to help you with instilling ear medication as well. So we got everything together. We washed our hands. I greeted the patient already. We explained the situation. We're going to put eardrops right in this ear canal. And then we put gloves on. We are going to have the patient lay down so that they are comfortable. And then we're going to pull the ear back and up to straighten that ear canal. And then we are going to take the dropper. We have read the label, checked it 3 times, make sure it's the proper medication, and we know what the dose is. If it was made in milligrams, we did the conversion into milliliters or droplets or whatever we could do. It's on the bottle. And it converts to 3 droplets. So we're going to insert the tip of the dropper without touching the patient's skin and let the medication flow along the side of the canal. We're going to try and drop it in there so that it can go all the way down to the bottom of the canal. We're not going to jam it in the patient. We're not going to try and push it in there and get in there better. We're just going to try and get a clear sight, up, back and up. We're going to take the dropper and we're going to go 1, 2, 3. 3 drops. We're going to hold the ear for a second, let the medicine run down into where it needs to go, and then we're going to release, and then we're going to do the other side if necessary. Before we switch to the other side, we are going to have the patient wait 5 minutes. Just going to let them lay here for 5 minutes so the medicine can work. If it's going to have to stay in there, we'll get them a cotton ball or something. So let them wait 5 minutes, and then we're going to insert that cotton ball into the ear. We're not going to jam it down in there. We're just going to place it in the ear so that way nothing leaks out. And then we are going to have them roll to the other side. This Mr. Cup didn't roll to the other side because he doesn't have another ear on the other side. And then we're going to start the process all over again. And then we're going to let them sit for 5 more minutes after we instill ear medication in this ear.